My name is Joel Nerem. I'm a practicing veterinarian from Pipestone, Minnesota. That's a small town located in the very southwestern corner of the state of Minnesota. I'm a member of a 29 veterinarian practice called Pipestone Veterinary Services. We have 3 veterinary clinics, 1 in Minnesota and 2 in Iowa. And I'm today talking about from the perspective of the swine industry, which is about 90% of our veterinary business is working with pig farmers in the 5 highlighted states that you can see on the map on the first slide. The first thing that Eric suggested I might do is just give a brief overview of what modern pig farming looks like today, and it's not meant to offend anyone, but this is how pig farming looks today for 95% of the farmers that we work with. Pigs are typically raised depending on the stage of production on different facilities that are catered for the individual specific needs for the animal at that phase of production. And so today we have breeding farms that contain anywhere from 1,500 to 5,000 sows that produce 21-day-old pigs that are moved off-site to a location called a nursery or wean-to-finish barn that is specifically designed to care for pigs of that age and size. And then the pigs are eventually moved to a finishing barn where they're fed until they go to market. And so you can see some of the life cycle stats there and some other information about pig farming. But as it relates to antibiotic use, we would be using antibiotics at any of these phases of production, depending on the various health challenges that might be present. And so each particular phase in the life cycle of a pig has different health challenges, and so we would employ antibiotics at any of those phases. So how do we use antibiotics in pig production? Well, much of this has been covered already, and we would use it for the main areas, treatment of disease, control and prevention, and as all of you know, the feed efficiency claims are going away, and so today we would be using it for control and treatment of disease. Antibiotic delivery methods, really 3 main methods of delivering therapeutic levels of antibiotics to pigs: individual injection, orally through the drinking water, or orally through the feed. When you talk to pig farmers today, or anyone in the swine industry, and ask them about antibiotic use and antibiotic stewardship, most of them would simply nod their head and say, yes, that's something that we feel like we've been doing for a long time. And if you look at the pork industry, many would point back to PQA, Pork Quality Assurance, which was established back in the late 80s. I was still in high school at that time. And so, the farmers today would say we have a long history of programs within our industry that are aimed at animal welfare, responsible medication use, and food safety. And so within our practice, within our industry, we've had a long history of veterinary oversight through vet-client-patient relationships, regular herd visits and health assessments. One of the things that I found when I moved into working with the swine industry and pig farms was just how most of the producers were very interested in wanting to work with their veterinarian, wanting to make sure that they had optimal health to optimize the performance of their farm. We spend a lot of time doing diagnostic work with pigs and with particular health challenges, wanting to make sure we get an accurate diagnosis, wanting to make sure that we're applying the proper treatment. Farms today use treatment records. That's part of PQA Plus, and part of the PQA Plus site assessment is accurate treatment records to make sure that we're using antibiotics appropriately and that we can, most importantly, account for the pre-slaughter withdrawal time that needs to occur from treatment before that animal can be sold to market. And so, again, I think it was a great comment that was made yesterday when we talk about antibiotic-free. My customers would say, well, all the pork I sell, all the pigs I sell are antibiotic-free. because we observe the pre-harvest withdrawal times after any treatment is done. We would also, in the pig farming industry, also have a history of non-antibiotic interventions to improve health. And so most pig farmers today would immediately recognize that improvement in health not only decreases the amount of money that they need to spend on medications, because all medication use is a cost, but it also improves animal well-being, because when animals aren't sick, we would say that they have an improved status of welfare or well-being. And those kinds of farms run more profitably. And so examples of production practices or the way the industry works today, such as multi-site production, all-in, all-out flow, so that we can break the cycle of any infections by removing all of the animals and cleaning the facility. Reduces medication use, improves health. High biosecurity and high health breeding stock farms are important so that we're not propagating disease pathogens or health issues. And high biosecurity. Today, if you go to most any of my farmer customers, you have to take a shower to go into their breeding herd. So we have to shower before we go in and see the pigs, not necessarily after. And so that's an example of the high biosecurity to which farmers today are trying to protect the health of their pigs. The other thing that I think that's interesting is within the last 5 to 7 years, the rise in air filtration that's being used in pig farms. Air filters are being employed in breeding farms to reduce the chance of new infections of respiratory viruses, particularly in areas where there are lots of pigs. And lots of chance for exposure. And so another example of the steps that are being taken to improve health, reduce the need for antibiotic use. And then the industry also has a history of disease elimination programs. Pseudorabies virus would be one example back in the 80s and 90s. And then really a lot of independent work being done in regions and by individual farms to eliminate some of the respiratory viruses that may require antibiotics to be used to treat secondary infections. And then finally, a focus on immunization versus medication. The last thing that I'll talk about is more of a reflection on our veterinary clinic and not a reflection necessarily on our industry, because I'm speaking specifically about what Pipestone is doing. But we're about to launch a product offering, essentially, to our customers. We're going to make available to them a system that will track their antibiotic use. And so we're making this available to the independent pig farmers in the regions that we work with. We want to provide them an opportunity to be able to track all their antibiotic use in their farm by group of pigs. It will track injectable medications, it will track water-soluble medications, and it will track their feed medications. And then we will independently house that information for them. It will be kept confidential, and then we will also allow them to be able to track their use over time and potentially benchmark against other producers. So this is one thing that we see that we can offer to our customers in case they're selling into a market that is going to require this kind of measurement. We think it's part of responsible use, which has been really how we've liked to approach this whole topic of antimicrobial use, antibiotic resistance. It's about responsible use. To be able to demonstrate responsible use, we should be able to track it. And then the other piece that we'd like to add on to this is also to track resistance, because that's the real issue with respect to antimicrobials that we want to deal with. And so we haven't fully developed that piece of it, but our full intention is to move forward and not only track use, but also track resistance over time. And we think this helps demonstrate responsible use going forward.